Good day. I'm Mark Armena.
And I'm Lim, and we are here to report on poisoning in the Philippines. The National Poison Management and Control Center responds to the growing number of poisoning incidents in the country in partnership with government agencies, the private sector, and other stakeholders. These incidents involve cases of acute poisoning, recreational drug abuse, chronic poisoning due to environmental and occupational toxicants, chemical incidents, and possible disasters.
Through the years, the center has observed the continuous increase of poisoning cases. In 2010, there were a total of 3,404 referrals as compared to 2,953 referrals in 2009. 31% of these referrals were admissions at the PGH. Majority of referrals were through phone referrals, which have increased in 2010 as compared to 2009.
Majority of referrals belonged to the pediatric age group, mostly involving toddlers. Route of exposure was mainly through ingestion, and circumstances of poisoning in 53.8% were non-accidental. In 94% of cases, poisoning occurred at home. 75% were discharged with full recovery, and mortality rate was less than 1%. The top 5 agents were silver jewelry cleaning agents, sodium hypochlorite, kerosene, paracetamol, and pyroroids. Among pediatric patients, kerosene is still the #1 commonly encountered toxicant, usually depicted by a situation such as this.
Ani, handa na ba ihawan? Ito na yung kerosene, no?
O sige, tignan mo baka mainom yan ng anak natin.
Sige, lalagay ko dito.
Wow! Soft drinks!
Whereas among adults, silver jewelry cleaners top the list of commonly encountered toxicants, as shown by this scenario.
Hello? Break na tayo!
Ha? Tinatapos mo na? Pero bakit?
Ayoko na sa'yo. Tawa na ako sa'yo. May iba na ako.
Bakit tinatapos mo na? Pagkatapos ng lahat ng pinagdaanan natin? Sige, pumunta ka ngayon dito. Pag-usapan natin.
Ayoko! Sobrang layo ko sa'yo.
Sige, pag di ka pumunta, iinumin ko yung panlinis ng kwintas na binigay mo sa akin birthday ko. Tapos pag nakita mong patay na ako, ikaw ang dahilan.
Majority of admitted patients involve acute exposure with single agents. The admissions usually involve adults. 77% of patients came from Metro Manila and only 18% came from the provinces. 96% of patients were discharged fully recovered. Mortality rate was 1.8%.
The National Poison Management and Control Center also works for research and development. Among their projects are the following. First is the health assessment study on metal exposure among Obando community residents near the May Kawayan Marilao and Obando or MMO river system. This concludes that the drinking water samples revealed acceptable levels for copper but elevated for cadmium. The estimated risk for development of proteinuria when drinking water from the sites with cadmium levels between 0.022 to 0.036 micrograms per milliliter was 2.2 to 2.8. Assuming that the cadmium level in oysters and shrimps are 0.9 parts per million, the allowable intake of a 50-kilogram man would be 56 grams per day for oysters and shrimps. Another project is called Health Effects of Lead Exposure Among 6 to 7-year-old Children in Barangays Tugatog, Bangkal, and Banga in May Kawayan, Bulacan, having the conclusions that the median IQ scores are low average for perceptual reasoning and working memory and average for processing speed. Majority of the children had average and low average scores in the three domains. 15 to 20% of them had borderline IQ scores, and children with high blood lead levels performed poorer, specifically in the tasks testing working memory. Among the growth parameters, exposure to lead seemed to affect the height of the child more than the weight. This observation, however, was not statistically significant. Additionally, other projects include health assessment on pesticide exposure among public health workers, health and environmental assessment of communities near Coral Bay Nickel Company processing plant, and health assessment of residents living near a hospital waste treatment facility in Silang, Cavite.
The National Poison Management and Control Center is also involved in toxicovigilance and prevention. Through the efforts of the Philippine Society of Clinical and Occupational Toxicology, Incorporated, Proclamation number 1777 was signed by President Gloria Macapagal Arroyo on May 2009, designating the fourth week of June of every year as National Poison Prevention Week. For 2010, the National Poisoning Prevention Week had the theme, Ating Alamin, Posibleng Lason sa Pagkain. The UPM-NPMCC developed 5 posters on poisoning prevention, which were posted in the main lobby of the hospital, namely, poisoning prevention tips, mushroom poisoning, nitrate poisoning, scombroid poisoning, and saxitoxin poisoning.
The center has addressed the poisoning issues through various ways. They have provided technical advice on the issue of poisoning from cyanide-containing silver jewelry cleaning agents. After a series of meetings with relevant stakeholders, the Department of Health and Department of Environmental and Natural Resources issued in September 24, 2010, an advisory banning all silver jewelry cleaning solutions containing cyanide and other toxic substances. Also, the gas leak at the West Tower condominium in Makati City was addressed through utilizing its membership in the Interagency Committee on Environmental Health. Because of this, the NPMCC has participated in addressing the possible environmental and health problems brought by the gas leak.
The NPMCC has played a monumental role in phasing out mercury-containing devices. They addressed the issue of glass thermometers filled with mercury, since such a toxic substance that is encased in such a fragile material poses a great health hazard.
For more inquiries regarding poisoning in the Philippines, you may contact the National Poison Management and Control Center 24-hour Poison Information Service through dialing 02-5241-078 or 02-5218-451 local 2311.